Thanks for joining us here at Stark Associates Insurance Agency. You might have just enrolled in Medicare, and I just wanted to make this video because it's important that you know that if you have enrolled in Medicare, you should be familiar with your benefits. And part of the benefits say that if you have a home health care aide take care of you, or in the case that you get admitted into a facility for some type of continuing care, like long-term care, you should really look at and invest in a long-term care insurance option. You should also discuss this with your financial advisor from a standpoint of how much coverage you should get based upon your retirement accounts and what is your ability to, if you needed to, self-insure. What is long-term care and what does it do? Long-term care is a policy that's meant to pay for your care in the case that you may not be able to do things that you and I take for granted day to day. They're called the activities of daily living, or ADLs. The ADLs could be bathing, transferring, dressing, toileting, or eating. So if two of those five you can't accomplish, there can be somebody that can come into your home and that can help you accomplish those tasks so you can keep doing as best as you can the things in living your day-to-day routine. There is a cost to it, and a home health care aide could cost anywhere between $60,000 and $80,000. I wrote it up here on the board, not neat, but. So you have to think about, do you have that money? Because Medicare is not going to cover that. And then also there's an issue if a family member or a loved one comes in to take care of you. They have to take time away from work. They might not be readily available when you need them. Also, the stresses that come along with somebody dealing with the lack to do things day to day, it's going to be high stress and not create a great environment. So if you should create a buffer and hire a service to do that, to take care of a loved one. Because if you're doing it personally, at times it could fracture your family, unfortunately, because of the stress level. We can take it a step further, and I would always remind you, if you are able to stay home comfortably, then you should do that for as long as possible. But if you are a danger to yourself or others, you have dementia, Alzheimer's, you're not sure what's going on at that current time, did I turn the stove on or off, I'm not sure, is the gas on or not, then, and you can't be watched 24 hours a day, then you might have to go to a long-term care facility, which Medicare does not pay for. That's where the long-term care insurance comes in. And it will assist you in paying that. And long-term care coverage can buffer those costs. So what's the cost of a facility? A facility in today's numbers, between $115,000 and $140,000 a year. Imagine a loved one staying in there 1 or 2 years. You have to ask yourself financially, how are you going to come up with that money? Where is it coming from? Is it coming from a retirement account? Are you getting it from a close loved one? Or are you going into debt? What do your finances look like? Long-term care insurance is there to buffer that blow. Depending upon your financial plan, it could cover almost all if you choose, although normally it could cover half, if not more. And what that's designed to do is lengthen the amount of time that your wealth that you've accumulated, you can keep that, because the insurance policy is paying a good amount and you're paying the difference, which would be a lot less. So you have to think about your family situation. Do you have loved ones? Do you have heirs that are going to be continuing on? And what is this long-term care event doing to your family? Is it draining the funds? Is the money flying out the window? Or did you look into a long-term care policy to put in place that can help lessen the blow, or basically the money suck going into the care facility? So I would urge you to take a look at it, speak to your financial professional, your fee-only professional, have a conversation. How does long-term care look? Some of you that are listening to this might be Medicare eligible or older, 65 or older. I would say if you're taking a look, be serious about possibly obtaining a long-term care policy. Maybe your late 40s or early 50s. If you think that's early, it's not. You need to prepare sooner than later, because the older you get, the more expensive the policy is, And also, the older you get, can you pass underwriting to get this policy when you truly need it? So planning is needed, and I'm happy to share ways and techniques that we use that can be best for you. So thanks again for joining us, and just remember, Medicare, as great as it is with the Medicare supplement policy, will not pay for your long-term care. So thanks for joining us.